Hi, Tim Russell here for Inovera Bioscience, 4-via vitamins and 4-bones extra D calcium tablets. Now, one of the effects of Crohn's disease is malnutrition. That occurs because the linings of the intestinal tract become inflamed and are less able to absorb nutrients from food. 2, there can be greater loss of nutrients, for example iron and calcium, from intestinal bleeding or the side effects of drugs used in treating the disease. In addition, diet may be limited and leave out some nutritious foods because they cause irritation or they're difficult to digest, like fresh fruits and vegetables. Now, malnutrition is not good for anyone, but it's a particular problem for children and teens because their growing bodies need vitamins, minerals, protein, and other nutrients to build bones and muscles. Getting behind the growth curve due to insufficient nutrition can have long-lasting effects. Sometimes, though, malnutrition can have near-term effects too. A recent study at Johns Hopkins Hospital in Baltimore compared complication rates in children who had surgery for Crohn's disease, and they compared them to their nutritional status before surgery. The kids were aged 5 to 18 and were classed as having either no malnutrition or mild, moderate, or severe malnutrition. Nutritional status was determined from body mass index, or BMI, and adjusted for age. There were 516 children in the study, of whom about 20%, 10%, and 4% were classed as mild, moderate, or severely malnourished, respectively. Now, the results for complications in the first 30 days after surgery were more common in children with malnutrition and corresponded to the extent of malnutrition. Children who were normal or not malnourished based on their BMI had a 10% rate of complications, while rates among the others were 19%, 20%, and 29% respectively for mild, moderate, and severely malnourished. These results suggest the odds of complication for a child having bowel surgery from Crohn's disease are roughly 2 to 3 times higher when malnourished before surgery. Of course, it's quite possible that malnutrition is related to severity of disease, and therefore the likelihood of complications may be more related to severity. However, I found this study quite interesting because it took a simple measurement, body mass index, and correlated it with a simple measure of outcome, complications in the first 30 days after surgery. BMI is easy to calculate. You just need a scale and a height measurement, plus the chart of standardized scores by age. The study authors were quick to say that more studies would be helpful to learn for sure if the BMI scores could guide the efforts to optimize nutrition. However, the results of the study certainly indicate that having good nutritional status before surgery is likely to be helpful and well worth a special effort to attain. One aspect of good nutritional status is maintaining good levels of vitamins and minerals. Our 4-via brand vitamins were specially designed for the needs of people with Crohn's disease and other conditions like ulcerative colitis, celiac disease, or bariatric surgery that make getting enough from diet alone is difficult. Well, thanks for watching.